In this video, we'll discuss about Parainfluenza virus. Belong to Paramyxoviridae family, and they are single stranded RNA containing enveloped viruses. There are 4 type of parainfluenza virus: type 1, 2, 3 and 4. The first discovered was Sendai virus. This was widespread natural parasite of mice, and it causes infections. Another antigenically identical virus was discovered. It was isolated from children with acute respiratory infection. It was isolated by heme absorption in cell culture, and this virus was named HA2 virus. First one is Sendai virus. Second one is by using heme absorption in cell culture. Second virus name is called as HA2. That means heme absorption virus 2. Already HA1 is there, so this one is the second one, heme absorption virus 2. Sendai and HA2 virus together form Parainfluenza virus type 1. So first virus Sendai virus, second one is HA2 virus, together to form Parainfluenza virus type 1, in which this Sendai virus is murine variety. That means it is presented in mouse. HA2 virus in human variety. Two together constitute the Parainfluenza virus type 1. The Sendai virus grow in allontonic cavity of the eggs, showing high titers of hemagglutinin. So, the Sendai virus grows in allontonic cavity of that egg, showing high titers of hemagglutinin. This which is similar that of influenza virus. So this one similar to influenza virus. That's why this Sendai virus is called heme agglutinating virus of Japan, HVJ, and also it is called influenza virus type D. Similar to influenza virus, so it have that name. That Sendai virus have that name, heme agglutinating virus of Japan, HVJ, and also called influenza virus type D. Now coming to parainfluenza virus type 2. This type 2 virus isolated from children with acute group called laryngotracheobronchitis. That means inflammation of larynx, trachea and bronchi. That's why the parainfluenza virus is also called as group associated virus, CCA virus. This virus grow in monkey kidney cell culture, producing syncytial cytopathic effect. Only the type 2 parainfluenza virus producing cytopathic effect, that is syncytial cytopathic effect. Type 2 parainfluenza virus isolated from children with acute group called laryngotracheobronchitis. tracheobronchitis, inflammation of larynx, trachea and bronchitis. So it is a group associated virus. This virus grow in monkey kidney cell culture producing syncytial cytopathic effect. Next, parainfluenza virus type 4. This virus was detected in the year of 1958 from children with respiratory infection. So this virus isolated in 1958. Children affected with respiratory infection detected by heme absorption in cell culture. It was named HA1. This was named HA1. The related virus of HA1 is SF4, which causing shipping fever in cattle. This virus presented in cattle, which causes respiratory illness. So, type 3 virus was first discovered 1958. Children with respiratory infection detected in heme absorption in cell culture. HA1 is this related virus is SF4, which causing shipping fever in cattle. So this one causes respiratory illness to cattle. Next, type 4 parainfluenza virus, fourth type. This was isolated from children with mild respiratory infection. Okay, mild respiratory infection, and it has two antigenic subtype, A and B. Type 4 isolated in children, mild respiratory infection, and it has two antigenic subtype, A and B. Clinical features, parainfluenza virus, they constitute about 10% of respiratory tract infection in children needing hospitalization. So 10% of respiratory tract infection in children required hospitalization. Most serious clinical disease group among all of them group, which is most commonly caused by type 1 and type 2 parainfluenza virus. Group disease commonly caused by type 1 and type 2 parainfluenza virus. Type 3 parainfluenza virus causes lower respiratory tract disease. Like bronchitis, inflammation, okay, it causes bronchitis and pneumonia, inflammation of bronchioles and pneumonia. Then type 4 parainfluenza virus produced only minor respiratory illness. In adult, parainfluenza virus causes milder respiratory infection, which most commonly include sore throat, hoarseness of voice. Rarely they can causes parotitis, that means inflammation of parotid gland. Next, epidemiology. Type 3 influenza virus infection is common in first year of life, and it is mainly endemic. Type 2 and 1 and 2 common in preschool children and also causes epidemic. Type 3 first year of life, this one is common, and this one is endemic. 1 and 2 epidemic, 3 is endemic, 1 and 2 is the epidemic. First infection is more severe than reinfection. Reinfection is very common in parainfluenza virus. So only the first infection is more serious. Then type 4 parainfluenza virus, even the first infection, it is mild. Spread of the disease is either air or through fingers. There is no vaccine available for this parainfluenza virus. Type 3 causes lower respiratory tract infection. Type 4 causes minor respiratory illness. Then primary infection more serious than reinfection. Type 4 is mild only. It can spread through air and fingers. No vaccine is available for type 4 parainfluenza virus. Laboratory diagnosis of parainfluenza virus. First one is collection of specimen, throat and nasal swab, because all the infection only respiratory tract infection. Then virus isolation, throat and nasal swab inoculated into primary monkey kidney cell culture, in which only type 2 virus producing cytopathic changes, that is sensational formation. Then virus growth detection by heme absorption, and this virus typing is performed by immunofluorescent heme absorption inhibition, heme agglutination inhibition. So virus growth reduction by heme absorption. The virus typing is performed by immunofluorescence, heme absorption inhibition, and heme agglutination inhibition. Then serological technique performed here, rise in antibody titer, value rising. Here we are using ELISA. Then that heme absorption inhibition test HI, then complement fixation. These are the serological tests we are using. Then molecular method, which include reverse transcriptase PCR, polymerase chain reaction. So what are the laboratory diagnosis methods? Sample collection. This one is the respiratory tract infection. So we are collecting throat and nasal swab. Then virus isolation, primary monkey kidney cell culture. Then virus growth detected by immunofluorescence, heme absorption inhibition, heme agglutination inhibition. Then serological ELISA technique, heme absorption inhibition, then complement fixation. Molecular technique, we are using reverse transcriptase polymerase chain reaction. Next, another virus, Newcastle disease virus, NCDV. This is also called avian paramyxovirus type 1. This Newcastle disease virus is the natural pathogen of poultry. In which it causes outbreak of pneumoencephalitis or influenza in poultry, and it causes high mortality. In India, this virus is called Ranicot virus. It have a name in India. Control measures: taking vaccination of birds, then slaughter of birds. Human infection with NCDV is self-limiting conjunctivitis in poultry worker and others who are in contact with infected birds. So this is all about parainfluenza virus and NCDV. Centivirus, HA2 virus. Thanks for watching.